Imagine looking at someone you know well, a family member, a close friend, or even your own reflection, and seeing a perfectly clear face yet having no idea who it is. This disorienting condition is called prosopagnosia, often referred to as the face blindness. It is a fascinating neurological disorder that highlights how complex our visual system truly is. At its core, prosopagnosia is a type of agnosia, which means the inability to recognize objects through a particular sensory modality, even though the sensory input itself is intact. In the case of prosopagnosia, the primary issue isn't it with the sight itself, but with the brain's ability to interpret and recognize faces. The medical basis of prosopagnosia primarily lies in the damage to specific brain regions, most notably the inferior occipitotemporal cortex, also known as the fusiform gyrus. While some evidence suggests the right hemisphere is more crucial for face recognition, for a persistent deficit to occur, lesions are typically found bilaterally. This area is sometimes also referred to as the Watt visual pathway, responsible for analyzing form and color. One of the most intriguing aspects of prosopagnosia is the paradox it presents. Patients with prosopagnosia can see and describe individual facial features, and they can even identify a face as being a human face. However, they simply cannot link that face to a specific identity. They can often recognize people through other cues like their voice, hairstyle, clothing, or even their unique gait. Some studies have even shown that while unable to consciously recognize a familiar face, these patients may still exhibit autonomic responses to it, suggesting a subconscious level of recognition. The deficit isn't always limited to human faces either. Farmers with prosopagnosia have been reported to struggle recognizing their own cows, and bird watchers might have difficulty identifying specific birds. This suggests that the brain regions involved are crucial for a more generalized specific recognition, the ability to identify individuals within a particular category rather than just recognizing the category itself. Prosopagnosia can also appear alongside other neurological deficits, deepening our understanding of brain connectivity. It's frequently associated with achromatopsia, a central disorder of color perception where vision appears in shades of gray, and sometimes with alexia, an impairment in reading ability. These co-occurring conditions further point to the close anatomical relationship of these processing centers in the brain. The causes of prosopagnosia can vary, but sometimes it commonly include strokes, especially those affecting the posterior cerebral artery territory, or tumors also. It can also be a feature of certain neurodegenerative conditions such as Alzheimer's disease or Lewy body disease. Prosopagnosia remains a profound and complex condition, offering a unique window into how our brains construct our perception of the world and people in it. It reminds us that recognition is not a simple act of seeing, but a sophisticated process of meaning making that, when disrupted, profoundly alters our connection to those around us.